As you all log in and join us to Gopher Experiences, I'd like to welcome you all to the University of Minnesota. My name is Marina Uehara. I'm the Director for Student Engagement and International Student and Scholar Services. And just like many of you joining us today here, I used to be an international student preparing for my journey to come here to the U of M as a new graduate student. So I'm excited for all of you who are joining us from all over the world. I see the Netherlands, Manila, Vietnam, India, Taiwan. So super excited to have you all join us from all corners of around the world, including locally here in Minnesota. I'll give it maybe another minute or so as people are rolling in and joining us. Okay, I believe we can start with our slides, V. So again, welcome everybody to the Gopher Experiences Health and Wellness webinar. We know that for fall 2023, health and well-being is one of our #1 concerns and priorities that our new international students have. So it's not just about maintaining physical health, it's also about maintaining mental health well-being as well. So we have amazing campus partners here today that are joining us to briefly talk about services, but also how to stay healthy while you're a student here today. We have folks from Boynton Health, the Office of Student Health Benefits, Housing and Rest Life, and obviously the team here in International Student and Scholar Services. We also know that healthcare in the United States is a little bit hard to navigate. You probably have seen documentaries and movies about it. So we have awesome people here today that are able to explain some of those differences and will provide some definitions as well. Even for those of us who have been living here for a very long time, it's a good reminder of us what these medical terms are. So today we're joined by Michelle from Boynton Health, Greg from the Office of Student Health Benefits, and then Katie from Housing and Rest Life will be sharing information about their different areas with us. We also use the Global Gopher Experiences events every 2 weeks to provide you with timely updates that are either impacting your international student status or even any updates that you may be hearing from the news. As you probably all have heard, in Minnesota, Minnesota just passed the Minnesota cannabis law that will go live on August 1st. A lot of students have been asking us, international clients who are asking about the new law, specifically how will that impact them. We will send you information about it in your new student email in August. We'll be posting this on our website, but given the fact that this is a state law and not a federal law, we are recommending students that, I will read what the statement is. The use of marijuana, federal law still prohibits the use of possession the use or possession of marijuana. If you're a US citizen, if you're not a US citizen, violations of federal law can impact your immigration status. Should you want to apply for citizenship or green card, or they may ask you questions, because it's not a federal law, that might impact your application as well. So that's something that we want you to be mindful of. Student Legal Services, who they presented with us a few weeks ago, they will be able to answer your questions should you have any. And then in the August newsletter, we'll be sending you some resources as well for you to have and review. So my next part is to pass it on over to Soliana, one of our Global Gopher Experiences leader, who will be briefly talking about the format of today's webinar.
Hello, everyone. My name is Soliana Shukur. I use she, her pronouns, and I'm an upcoming sophomore in the College of Liberal Arts studying computer science. I will go over the webinar of this overview of this webinar. This webinar is being recorded as always and will be posted on the ISSS website. We recommend using the gallery view or speaker view. General information will be provided, and we expect that you may need to reach out to an office about a situation-specific questions. The first 30 minutes will be panelists introducing themselves and reviewing general information related to health and wellness during the pandemic and right now. Partners include Health Emergency Response Office and Boynton Health Services, Office of Student Health Benefits, and Office of Housing and Residential Life. The second 30 minutes will be question and answer sessions with the common pre-submitted questions during registration. And the Q&A function can be found at the bottom of your screen, and you have the ability to submit questions anonymously. I'll pass it off to Michelle.
Hello, everyone. I'm so excited to be here with you today, and I look forward to welcoming you to our campus in the fall. I'm Michelle Trumpy. I use she, her pronouns, and I'm the Director of Public Health at Boynton Health. And I'm going to be talking with you today about all of the services we have just for you here at Boynton. Next slide, please. Boynton has been serving the University of Minnesota for over 100 years. We are committed to helping you live your healthiest life, and we want to be your first call if you are feeling sick. Healthcare costs are definitely going to be the lowest for you when you access them through Boynton. Next slide, please. This is just a picture of all of the services located under one roof in one building on our East Bank. We have primary care if you need regular checkups. We have mental health clinics. This is important if you're feeling lonely, if you're feeling really stressed about school. It's really normal to have those feelings and to get help from our mental health clinic. We have the dental clinic, and so it's important to get your teeth checked a couple times a year. And if there's an issue going on, the dental clinic can address that as well. We have our eye shop, our eye clinic, and everyone has the ability to get an eye exam every year. That's an important way to take care of your health. Even if you don't wear glasses or contacts, it's important to get that checkup. And if you do wear glasses or contacts, you can get those from the eye shop as well. We have the pharmacy if you have a prescription that needs to be filled, if you go to the doctor and you get some medication, or if you need to buy something over the counter like headache medicine, cough medicine, things like that. We have physical therapy and nutrition if that's recommended for you, our gynecology clinic and our gender care clinic. And then if you're feeling sick, you can walk right into our Gopher Quick clinic or our urgent care clinic, and they take care of a wide variety of issues: sore throat, cold, if you're concerned that you might have COVID or the flu, if you've hurt a bone, a strain or a break or anything like that. And then finally, we've got our immunization and travel clinic, and I'll talk a little bit more about some of the immunizations that you need to be a student here. All these services are covered, and Greg will talk about that a little bit more. And next slide, please. So our main building is on the East Bank, and we are open every day of the week from 8 to 4:30. And then you can see a little map. We're behind the Union, and we also have a satellite clinic in St. Paul that's open 3 days a week. And then we're going to talk about ways to get treatment in the next slide. You can call our appointment line to make an appointment, or you can schedule some appointments through our Boynton portal, which is available to you. You can walk in if you're feeling sick and you need something quickly. You can walk in to get care at our urgent care. And if you're not sure, maybe you have some questions you want to talk through with someone, you can call our nurse line, and that's a service that's available 24 hours a day. You can call at any time about questions or symptoms. That is a great resource available to you. Next slide. So there's a lot of information on immunizations and vaccinations. So this is a QR code where you can get all of the information. And in the next slide, I'm going to talk to you in a little bit more detail about what's required and what's recommended for you. So on the left-hand side, you can see the 2 required vaccinations. You've got the diphtheria and tetanus, which is given as one vaccine. And then you've got the measles, mumps, and rubella, which is also given as a single vaccine. So it's 2 vaccines that are required. by the 6th week of classes in the fall semester. So you need to show proof of having those 2 vaccines. Otherwise, if you don't do that by the 6th week, you won't be able to register for spring classes. You can do this upon arrival in the US. You can come to Boynton. These are completely covered under your insurance plan. And then there's also the list of recommended vaccines as well. Meningitis, there's 2 vaccines, the HPV series, the hepatitis B series. Getting an annual flu shot every year is an important way to stay healthy. And then the latest COVID-19 vaccination. And again, these are all available at Boynton for you. Next slide. So here's just some tips to stay healthy and safe, especially from COVID-19 and influenza and even things like the common cold. So it's really important that you stay home when you are sick, and you can talk with your professors about that and let them know that you need to stay home if you're feeling sick, and that's okay. If you are concerned that you might have COVID-19, you can absolutely take a test. Boynton offers testing if you're feeling sick, so that urgent care or the Gopher Quick Clinic. And it's important that you follow isolation guidelines if you test positive. So that means staying home away from people for at least 5 days from your symptoms starting. It's important to stay up to date with your vaccinations. Again, we've got the COVID-19 and influenza vaccine at Boynton. We offer these on a drop-in basis in W227 on Mondays and Wednesdays from 10 to 2. You don't need an appointment. You can just come to Boynton and get those vaccines. We also offer the tetanus and diphtheria vaccine on a drop-in basis. And we also offer the HPV vaccine on a drop-in basis. And we are soon going to be offering the Mpox vaccine in this clinic as well. Some people may be eligible for Mpox. We do have some cases in Minnesota, and our best prevention is getting vaccinated. And it's important to wash your hands regularly, and that's a great preventative strategy from getting sick from a variety of illnesses. So now I'm going to talk a little bit about a policy that's really important that people know about and that they follow while they're on campus. So our Twin Cities campus is completely smoke and tobacco free. So you cannot smoke or vape anywhere in buildings or outside. And this is true of tobacco and cannabis. Marina talked a little bit about that. Starting August 1st, cannabis will be legal in the state of Minnesota. However, at the University of Minnesota, we are required to follow federal laws. So cannabis possession, use, distribution, and growing are all prohibited on campus or while participating in any campus activities. And if students want to explore quitting either cannabis or tobacco, we do have resources for you in our mental health clinic. You can call and make an appointment. Next slide. The Nutritious You Food Pantry is a common resource that international students find very helpful while they're staying here at the University of Minnesota. It is located at the Union, Kaufman Union, on the first floor behind the Goldie Gopher statue. It's open 3 days a month during the school year, typically the last week of the month from 12 to 6. And you can get fresh and healthy food offered to any students who need it. So if you're having a hard time getting enough food to eat during the month, this is a great resource for you. Next slide. The Gopher Chauffeur is a safe ride home in the evenings. It's available 7 days a week. There's an app you can download. You can see the QR code here if you want to check that out. This is great if you're out late studying and you need a safe ride back home within the boundaries. The Gopher Chauffeur can get you there. Next slide. I encourage everyone to check out our PAUSE program, Pet Away Worry and Stress. This is registered therapy animals, and their humans come, and it's a place for students to connect, to de-stress, to take a break. There's dogs, cats, chickens, horses, cats. They have availability every day of the week, Monday, Tuesday, Wednesday, and Thursday at different locations, and you can check out where they'll be on the pause calendar. Next slide. So another great resource I want to tell you about are health advocates. These are students who are in residence halls, some off-campus apartments, fraternities and sororities, and are a great first call for help, or if you have questions about healthcare or accessing resources. Next slide. They're all first aid and CPR certified. They can respond to just common health issues. They can help you with resourcing across campus, and they have very basic supplies and kits. They have cold and cough medicine, and safer sex supplies is just a couple of examples. And then finally, we do have safer sex supplies or healthy relationship supplies available across campus. You can get them from the health advocate in your residence hall. They are also available at Boynton in the pharmacy. These are completely free to you and are an important part of keeping safe and healthy. As we talked about a little bit, the recovery resources that are on campus. And so ROC is a student group for students either in recovery from drugs and alcohol or choosing to live a completely sober life. There's weekly fellowship meetings that students can be a part of. It's a great place to find community. And they also plan free social events that are completely alcohol free. So that's a great resource. I know I talked a lot about different things at Boynton. The next slide is a QR code to our website that will help get you to all those resources if you want to learn more. And again, welcome to the University of Minnesota.
And hello, everybody. I'm Greg Thurston. I'm the director of the Office of Student Health Benefits. I use he, him pronouns. Could we go to the next slide, please? So today I want to highlight some health insurance requirements for the University of Minnesota, as well as some items related to health insurance in the United States that's probably different from health insurance in your home country. Health insurance in the United States is complicated, as I think Marina maybe said earlier, even for those of us who were born here. In the few minutes we have now, I can only give you a general overview of how it works. The booklet with all the health coverage information, known as a summary plan description, is actually over 100 pages long and is posted on the Student Health Benefit website. After this presentation, you're likely going to have additional questions in the future. The Office of Student Health Benefits contact information is provided here, and I want to assure you that we're committed to helping you with any questions you have either now or in the future. Next slide, please. First, it's important for you to realize that unless you qualify for a waiver, the University of Minnesota requires you to be on either the university's student health benefit plan or the university's graduate assistant health plan. This requirement has been in effect for over 40 years and applies to all university students, both domestic and international. It's necessary so that you can focus on academics and not worry about whether you can obtain medical services if any health issues arise. Waivers from coverage on the university plan are only granted if you're remaining in your home country for the semester or have United States employer-based health insurance, or your home country has an arrangement with the university which qualifies you for a waiver. Only the countries of Oman, Saudi Arabia, United Arab Emirates, and Kuwait have arrangements allowing waivers. If you qualify for a waiver from the university coverage, you should email the Office of Student Health Benefits for assistance with the process. Next slide, please. If you're a graduate fellow or graduate assistant with qualifying appointment from the university, you should enroll in the graduate assistant health plan. The university pays a significant portion of the premium for the graduate assistants, so your contribution is quite low. At the beginning of the semester, your account is charged $195, just over $195, If your appointment is 50%, you pay no additional premium for the entire semester. If your appointment is less than 50%, then you pay an additional amount for the semester based on your appointment level. You must complete an enrollment form to enroll in the Graduate Assistant Health Plan. To enroll, you go to the website shb.umn.edu and select Graduate Assistance, then select Enrollment. Complete and submit the enrollment form to the Office of Student Health Benefits. Failure to actively enroll in the Graduate Assistant Health Plan would result in the graduate assistant being automatically enrolled in the Student Health Benefit Plan and charged its full cost of coverage. So I want to stress, if you're a graduate assistant, please make sure you fill out the enrollment form for the Graduate Assistant Health Plan, because that plan is significantly cheaper to you than if you get put on the Student Health Benefit Plan. Graduate students without appointments and all international undergraduate students not qualifying for a waiver must enroll in the Student Health Benefit Plan. Coverage generally begins on August 21st, 2023. However, if you need services prior to that date, please contact the Office of Student Health Benefits and we can have your coverage effective as of the date that you enter the United States. The cost of the Student Health Benefit Plan is $1,795 per semester and is billed to your account at the beginning of the semester. To enroll in the Student Health Benefit Plan, you click on Enroll Me on the insurance plan communication that's sent to your MyU account. The Office of Student Health Benefits does not recommend purchasing any additional insurance, and even if you choose to do so, it will not allow you to waive off the Student Health Benefit Plan. Next slide, please. In the United States, even with health insurance coverage, an individual may have additional out-of-pocket costs when seeking medical care. Copays are small fixed dollar amounts that are charged each time you go to the doctor or have a prescription, and then the insurance plan pays the remainder of the cost of that doctor's visit or prescription. With the Student Health Benefit Plan, when you have services outside Boynton, you may need to pay a deductible and co-insurance. Deductibles are annual dollar amounts which must be paid for services before the insurance begins paying for services. Co-insurance is a percentage of the claim that you must pay, with the insurance paying the remainder. However, all plans have a maximum annual out-of-pocket amount, so that once you reach that amount, the insurance pays 100% for all remaining eligible claims. The Office of Student Health Benefits has detailed information on its website showing coverage levels for different types of services for each of the health plans. Next slide, please. Our plans are designed so that most individuals have very low out-of-pocket costs when obtaining medical services. And as Michelle said earlier, Boynton is generally going to be your lowest cost and most convenient alternative for medical care. In fact, most services provided by Boynton result in no out-of-pocket costs to those who are on the Student Health Benefit Plan, and just a $10 copay for those who are on the Graduate Assistant Health Plan. The medical identification card you receive from the insurance company will have their website information, enabling you to find other available in-network providers when needed, such as when you require immediate care when Boynton is closed, or if you require a service not provided by Boynton. Our insurance company is called Blue Cross Blue Shield of Minnesota, and the provider network is called Aware. That's Blue Cross's largest provider network. It has hundreds of thousands of providers in the United States. You will need your medical identification card when obtaining services or picking up prescriptions at places other than Boynton. If using a provider other than Boynton, it's important to confirm that they are in network before obtaining services, as you often must pay more out-of-pocket costs when utilizing providers who are not in network. It typically takes a couple of weeks to receive your medical identification card. If you need medical services prior to receiving your card, please contact the Office of Student Health Benefits for assistance with your coverage. We're here to assist you and help answer any questions you may have about your medical coverage. The next presenter is Katie Olson-Williams, who will provide some important information on housing and residential life.
Thanks, Greg. Hi and welcome. My name is Katie Olson-Williams. I use she, her pronouns, and I am an assistant director here in Housing and Residential Life at the university. Housing and Residential Life provides housing to over 7,400 students on campus in 17 buildings located on East Bank, West Bank, and St. Paul campus. We provide opportunities for students to meet others and have staff on site as a resource and for crisis response. In addition, we have almost 40 unique living and learning communities where students live in a community with others that share the same academic goals or personal interests. We do provide early arrival housing from July 23rd through August 25th in Frontier Hall, whether or not you live on campus this fall. Early arrival housing is only available for enrolled U of M students as we can't accommodate families. Move out is Friday, August 25th by 7 p.m. On that day, we will provide transportation assistance to those living with us in the fall if you need later that afternoon or early evening. In addition, we will provide some opportunities in Frontier during your stay for you to be able to meet others and connect with other students that are here early. Move-in for new fall residents to our apartments begins August 15th, and for our traditional residence halls, August 28th. Assignments will be emailed out at the end of this month, and if you have not yet found fall housing, we are still accepting applications. There are limited spaces in our apartments and traditional residence halls for first-year students. Pioneer Dining Center will be open in July and most of August. However, it's important to check the dining webpage for hours of operation as some dates are unavailable. Dining is not included in the early arrival housing cost. There are also other options near Frontier Hall for eating, and a kitchenette is available in hall if you wish to cook. Next slide, please. So your health and safety is important to us. The websites listed here provide additional information for you to be aware of, as it's all of our responsibility. We no longer have any specific protocols for COVID. However, our website does offer resources available to you if you have questions about what to do if you feel sick, have been exposed to someone with COVID, and updates around policies such as masking. Masks, of course, are not required unless you are isolating. However, community members are welcome to wear one if you wish. We encourage everyone to take responsibility for their own health needs and to do the right thing when not feeling well, such as testing and isolating if necessary. As a student, it is important to take care of your own well-being as well. There are several opportunities in Hall to connect with others, including jobs within housing and residential life, so you may work where you live, or create and or participate in one of our many groups. Our staff are available as a resource to you in each Hall community, but we all play an important role in our community. Should you experience or witness a bias incident, please report it as soon as possible to your community advisor, or submit a report to the Bias Response and Referral Network so we can provide support and follow-up. I will now pass it back to Marina from ISSS to lead the question and answer portion of the webinar.
Thank you, Katie, and thank you to Michelle and Greg for sharing with us. I'll be inviting Yewon, one of our international student leaders, to talk a little bit about how to stay connected with our office should you have additional questions. Yewon?
As a reminder, there are a lot of ways to stay connected with ISSS and our partnering offices. If you have any specific questions about your situation, please email those appropriate offices. Their contacts have been already shared in the chat, and we'll be sharing them in the next slide as well. Right now, here is a reminder of how to connect to ISSS. So ISSS new at umn.edu for new students. You can additionally find information on our website. Also, you can join our Discord channel and follow us on Instagram at ISSSUMN for more information and updates on events. I'll pass it back to Marina for the Q&A portion.
Thank you, Soliana. I didn't realize that Yewon was unable to share with us. So thank you, Soliana, for stepping in and sharing how to stay connected. On our next slide, I do want to acknowledge our campus partners that are here today to answer questions that you'll be submitting. This isn't a webinar, it is a Zoom meeting, so it allows us to see all of you. So if you can turn in your cameras, that'd be great. But if not, we totally understand. On the chat, there's a chat button right here. You'll submit your question. You can either submit them directly to me, but we'll be addressing some of the pre-submitted questions we have received. So today we have Michelle and Anne, both from Boynton, who will be able to answer questions over on the chat or live. Greg will stay here with us to answer questions about the Office of Student Health Benefits. And Katie will also stay here to answer questions on behalf of Housing and Rest Life. And we have two student leaders today who are able to answer some of the questions you have all submitted. Key and Ayapa, when I ask you to answer the questions, I'll have you all introduce yourselves. As a reminder, we want folks to feel comfortable asking us questions. And if this is an individual, more specific question, please email us at issssnew@umn.edu, which is specifically for our incoming new international students. I will get started with some of our questions. Some of our pre-registration questions have to do with health insurance. So Greg, I'll ask you a few questions that we have received. If I am arriving on August 10th, for example, I know you mentioned this earlier, when does student health benefits plan start? If I land on the US before these dates, what do I need to do?
Yeah, so a couple of things here is the semester coverage officially starts August 21st. So if you get into the United States prior to August 21st, and don't do anything, then officially you're going to get an ID card and your coverage with Blue Cross Blue Shield would show effective August 21st. For most people, if you don't need immediate services, we would ask that you just kind of go through that process and just allow the coverage to start on August 21st. But if you need services prior to that, if you have vaccinations you want to get done right away, or anything like that, then you're going to want to contact our office and we can get your coverage started effective the date that you entered the country.
Got it, Greg. So it's all about reaching out to your office and making sure that you get the additional coverage, or not the
Correct.
Additional coverage,
You get the
earlier.
timing of it set back to the date that you arrive in the United States.
Got it. Thank you, Greg. My next question is for both you, Greg, and Michelle from Boynton. It's regarding immunization, and it's a multiple set of questions. What are my immunization requirements, and can I get them done after I arrive to the US? B, will my insurance cover it? And C, we just received this on the chat. If we receive the required immunizations in our home countries, do we need to submit documentation as proof?
Yes. So I will start with the A. So the two required vaccinations for everybody attending the University of Minnesota are the diphtheria and tetanus, that's typically given as one vaccine, and the measles, mumps, and rubella, or called MMR, which is given as one vaccine. And you can get those when you arrive to the US. You can get them at Boynton. And if you've already received these vaccines in your home country, you do need to submit the proof that you've gotten that, and then you would be compliant with that. And then Greg can answer the insurance question.
Yeah, so the insurance one, the required ones absolutely are covered by the plan. So you'd have no cost for the diphtheria, tetanus, or the MMR. You'd have no cost, meaning the insurance will cover 100% for the COVID as well as the flu vaccine. The other ones you might have some out-of-pocket cost for, the other recommended ones.
And I'm going to put right in the chat that website where people can see how they would submit their proof of vaccination.
Lots of insurance questions are coming my way, Greg, so I'm going to ask you a few
Sure.
more questions. One of them is regarding, does the graduate assistant health plan or the insurance plan include care for eyes and teeth? If not, do I have to buy additional insurance?
Yeah, so in terms of for eyes, both the plans, whether it's the student health benefit plan or the graduate assistant plan, cover eye exams. Okay, so that's eye exams are typically covered by medical insurance in the United States. So no cost for an annual eye exam under either plan. Now, what some people may not realize is that contact lenses and glasses and frames are not covered by medical insurance. So, you can get your exam for free, but if it turns out that you need contacts or corrective lenses, those would be out-of-pocket costs. And there is no additional insurance that we offer that would cover those types of things. Now, in terms of dental, there's two different things. I'll start with the graduate assistant plan. The graduate assistant plan, that medical plan, does include dental at Boynton. So Boynton Dental would be your dental provider under the graduate assistant plan. It's great coverage because it covers 100% of preventive services. So your cleanings and annual checkups, that's covered 100%. If you need restorative services, then 80% is covered. You would pay 20% of the restorative services, things like crowns, bridges, root canals. And there's an there's an annual maximum benefit under that plan of $1,000. So the plan will only pay up to $1,000 of your restorative services that are needed. So if you need 10 crowns, you're going to have to basically get one a year, that type of thing, for the plan to cover it. Now, on the student health benefit plan, the student plan has a limited dental plan connected to it. And so the dental services that are covered under the student health benefit plan are preventive services. So basically cleanings and annual checkups, but there are no restorative services. So crowns, bridges, root canals are not covered on the base student plan that's connected to the student health benefit plan. However, to make things a little more complicated, if you want to have restorative services covered, then we have an optional buy-up plan for the student dental, and that's moderately expensive. That comes to about, equates to about $70 per month, and you pay the full semester at a time, so $400 and some for the semester.
Thank you, Greg. And I have one more question for you, and then we'll also have questions for Michelle and Katie as well. So for folks who have additional questions about their specific insurance, please reach out to the Office of Student Health Benefits at umshbo@umn.edu. I see a lot of questions on there about your specific situations. You'll have to work with someone from the Office of Student Health Benefits. But finally, Greg, do I need to show my insurance card in order to get my immunizations? And the other piece of that question on immunizations, Michelle, is if I can't find records of those, is it safe for me to retake those immunization vaccines?
Yeah, I think for the immunization, I don't think you would have to show the card at Boynton as long as you're in our system. But if you're getting it anywhere else, then yes, you would need the card.
And if you cannot find the record, that is okay. Our nurses will help you determine the next best step. There are some tests we can do to see if you have immunity. And so if you have immunity, that counts, and that's okay.
Thank you. Thank you, Greg, for answering all the questions around insurance. I'll move on to both Michelle and Katie for the remaining questions around health, and then Katie, questions around housing. Michelle, one of the questions that we also had was around mental health. I know that Key will be sharing a little bit more, but what is your advice in navigating mental health resources from a staff perspective, and then Key as a student perspective?
Yeah, I want to let everyone know that Boynton is here for you. Boynton is here for you for your mental health and well-being and your physical health and well-being. And so if you are feeling lonely, or if you're feeling stressed, if you feel like you want to talk to someone, I want everyone to know that that's okay. That's really normal. And it's really easy to get services at Boynton. You can call us. We will make an appointment. You can make an appointment and see one of our therapists. They can help you determine what treatment might look like for you, how often you might need to come in. If you are interested in a group therapy, they can help you with that too. There's lots of options, and I just want you to know it's really easy to get services for your mental health and well-being at Boynton.
And I can share a bit about my experience. Honestly, I know there's like a bit different in our culture between like, Eastern, Western cultures about mental health. What I define mental health is maybe you just, experience a little bit of like stress, like anxiety, moving to like a new place, changing to, high school to college, and that's totally fine. Just, like, reach out to us, how to cope with it, and like we all say service are all included and free, and it will be on the Boynton mental health.
I just wanted to add one other quick thing, is that these services are completely confidential. So if you go to Boynton and see a therapist, that is only between you and the therapist. The therapist will not tell your professors, will not tell your family. There's laws that protect that private data of yours. And so sometimes that can be a concern. And I just want to let everyone know that it is a confidential service, and you can talk more about that with your therapist if you make an appointment.
Thank you, Michelle. And thank you, Keith, for sharing that. I know, Michelle, you have to step out in just a little bit. So if you have any additional questions for Boynton, Anne is also available to answer them on the chat, as you can see. And then you can reach out to Boynton directly at bh-quest@umn.edu, or visit their website, as they have quite a comprehensive information there for new students. I want to be moving on to the topic around housing. Katie, we have some questions around housing from some of our international students. One of the questions is, someone submitted it over the chat. Are there any move-in resources if we are arriving after August 25th?
Yeah, so if you are living on campus, we can certainly assist you and help you figure out what your arrival date and time is to get you into your assigned space. If you are not living with us in the fall, unfortunately, we don't have any open spaces. All of our buildings will be will be occupied by fall residents, or will be getting turned for that move-in starting just a couple days later. However, on our website, we do have an off-campus listing. And so if you are looking for off-campus housing, we do provide that listserv. I would recommend using that listserv. We have landlords that are on there that are, they have to register with us. They have to be in good standing with the university. And so it's, folks that we have worked with. So definitely utilize that resource if you are looking for off-campus housing. Otherwise, if you are looking for just a temporary space until your off-campus housing is available, I would recommend looking at some of the area apartments, and we will, or not apartments, hotels. But we will also, if you are arriving early, and staying with us in Frontier, we will have some resources available. We're happy to answer questions and assist you in that search as well.
And then Katie, you had mentioned a little bit about off-campus living. We have Ayapa here today who also works with the off-campus. I will let Ayapa do his introduction and share some resources around off-campus living.
Thank you, Marina. My name is Ayapa. I go by the pronoun he, him, and I'm a global Gopher leader with ISSS, and I'm also serving as the neighborhood liaison officer with off-campus living. So if you have any questions regarding off-campus staying, or you have you need to know anything more, we're going to drop our website, our Instagram, and email here. And also, like Katie mentioned, we also have a lot of resources that has a lot of listings of various places that's present around the campus. So that's probably something you can look at. So that's another thing. And yeah, so these are the two main resources you would probably be looking at.
Thank you, Ayapa. Katie, additional questions around housing as well. If a student is living in international early arrival housing, two-part questions. What if I don't stay for the whole duration that I initially reserved? Will I be charged for that? And two, if I have an on-campus assignment, can I move directly into my on-campus assignment from the international early arrival housing?
Sure. So if you make a reservation and your travel plans change, you are only going to be billed for the actual nights that you stay with us. And so all of the billing will actually be done. It will be added to your student account in September. And so again, it will only be for those nights that you stay. So if you don't come the day that you originally register, or if you check out early, that is okay. Totally fine. You will only be billed for the nights that you stay. If you are living with us in the fall, we will start, again, apartments open the 15th. So if you have an assignment in the fall for an apartment building, we will have you move over to your apartment beginning on the 15th. If you're arriving after the 15th and you're assigned an apartment, you can go straight to your fall space. If you're in a traditional residence hall, that date will be August 22nd. So you can certainly start moving in. If you're here prior, you can move from Frontier to your fall space beginning August 22nd on your own. But again, if you want that transportation assistance, Frontier is located on the East Bank of campus, and say your fall assignment is on West Bank. If you would like some transportation assistance, that will be on Friday the 25th. So again, depending on your arrival date. Now, if you do come the 22nd or later, we will have you go straight to your fall assignment or fall building so that you can be there and not have to, in most buildings, move twice. Bailey is our only kind of one scenario where you will go to a temporary space in Bailey Hall until Sunday, but more information is on our website. Once you check in to early arrival housing, if you do come for early arrival housing, we will again give you a packet with a lot more information about your time with us, about all of the move information. And again, feel free to reach out to us as well with further questions.
Thank you, Katie. And I believe this wraps up all of our pre-submitted and some of our submitted questions. If you haven't gotten your specific question answered, please reach out to the contact information that are listed on our screen for your specific questions. Some of them were specific to your situation, so it's best that they connect with you and make sure that your accounts are good to go. I did notice on the chat, there was a few questions around 24-hour assistance or what to do in an emergency. I want to highlight that Boynton does have a 24-hour nurse line. You can call that nurse line and that helps you determine if it's not a Boynton nurse, it'll be someone from Fairview. They will determine whether you should go to an emergency a hospital or clinic, or whether it can wait for the next available business day. Usually I've called it, they're super useful. Sometimes you just get really anxious because medication is a little bit different here, or you don't know what's over the counter, so they can help you kind of navigate that with you, and they're super friendly and super nice. So I highly recommend at least keeping that phone number with you when you first arrive. A lot of the folks that presented here with us today, you will be seeing them throughout the remaining of the summer, or when you come in here in person. They are part of several activities that the university has planned. So you'll definitely see Greg and Michelle and Katie throughout different campus resource fairs or events. I do want to highlight that with Boynton, ISSS and Boynton will be hosting an open house on August 29th. That is our Global Gopher Experiences Academic Success Day. We are partnering up with Katie to host events with and for all of you when you arrive for international arrival housing. And Greg is part of several of our international committees to really make sure that international students get the best service that they can as well. So again, many thanks to our campus partners who are here today. Please reach out to them for additional questions. If you don't know where to start, you can always email us at issssnew@umn.edu, and we will refer you to the appropriate people here on campus. This wraps up our webinar and our session today. We'll be playing a video, and this is typically what we do. But before we move on to the next part, I'll have one of my student leaders introduce the next session that's going to be happening in 2 weeks. And I believe that's Soliana in the next slide. Soliana, can you introduce the next event?
Yes. So Gigi, we have a lot of events. The registration link will be shared on the next slide. So yeah, we will share the link in the next in the chat right now. Thank you for joining us, and we'll be playing the video.
Welcome to the University of Minnesota. We are Boynton Health, and we're excited to help you get a strong start to your college career here. We understand that it can be overwhelming to take control of your healthcare needs. That's why we're committed to helping empower students like yourself. There are a variety of clinics you can choose from here at Boynton, from primary care, urgent care, Gopher Quick Clinic, dental and vision services, gynecology and gender care, nutrition services, physical therapy, immunization, and a pharmacy. And as a student, you can access most of these services at little to no cost.
So now that you know what Boynton Health has to offer, you might be wondering how to get treatment. There are many ways to access care. You can make an appointment by calling, stopping by in person, or visiting My Boynton online patient portal. Through this patient portal, you can access immunization records, receive test results, and update your patient profile. Not sure what kind of help you need? No worries. We have a 24-hour nurse line available to help you access the right care.
Of course, after you make your appointment, you might be worried about how much it will cost. As a college student, finances can be a huge concern. Most students can receive care at little to no cost. You must meet 2 criteria. You need to pay the student services fee for the semester that you're enrolled in, and you need to be on an insurance plan, either a private plan or the university's plan. Most students must have insurance to be able to attend the university.
The plan offered through the university is called the Student Health Benefit Plan. It is charged to your student account alongside the student services fee and tuition. The Student Health Benefit Plan fee varies yearly, so be sure to check out our website for the most up-to-date cost. You might choose to opt out of the Student Health Benefit Plan and might be worried about paying for Boynton's health services. Don't worry. Regardless of what kind of insurance you have, most students can be seen at our clinic at little to no cost.
Boynton Health also does a lot of public health outreach across campus. We work to promote the physical, social, and emotional well-being of all students across campus inside and outside the walls of the clinic. Be sure to take advantage of programs like Nutritious You, Food Pantry, and Gopher Chauffeur. If you're feeling overwhelmed, you can put away worry and stress with Pause.
If you're a student living in a residence hall on campus or a fraternity and sorority, talk with your student health advocate. These students are first aid and CPR certified and can help with other common health related issues by referring you to other campus health resources and sharing information. These students provide cough drops, bandages, safe for sex supplies, cold and cough and pain medicine. Other health promotion resources also include stress check-ins, safe for sex supplies, and Recovery on Campus, which is a student group that provides support and resources for university students in recovery through social activities and regular meetings. Boynton Health offers individual therapy, couples and group therapy, and student counseling services. We also offer stress check-ins. Stress check-ins provide an opportunity for you to talk through stress in your life, come up with solutions, and to connect with campus resources.
You can find us on the East Bank Minneapolis campus and the St. Paul campus. We're open Monday through Friday during general business hours. Don't hesitate to give us a call or visit us at the clinic. You can find more information at boynton.umn.edu.
Be sure to visit MyU to fill out the immunization form and the insurance declaration form.